Wonderful. Good morning, everyone. Good morning. My name is Frederica Williams, and I am the CEO of Whittier Street Health Center. First, I would like to recognize my fellow colleagues, HUD New England Deputy Regional Administrator Robert Forty, HHS Acting Regional Administrator Paul Jacobson, HRSA Regional Administrator Jeffrey Beard, Boston Housing Authority Administrator Kate Bennett, and Alice Haywood Taylor Tenant Association President Matilda Drayton, as together we announce the United States Department of Health and Human Services and the United States Department of Housing and Urban Development's joint effort in New England to increase access and awareness of COVID-19 vaccinations among disproportionately affected communities, including among housing and urban development assisted households and people experiencing homelessness. As a HRSA public housing grantee over many decades, we have received generous financial and technical support from the Bureau of Primary Health Care and the Department of Health and Human Services to provide clinical and social services and outreach and health education to public housing residents in our service area. Adults who receive federal assistance for housing have higher rates of chronic conditions and are greater utilizers of healthcare than the general population. Research shows that housing needs left unaddressed are a strain on our healthcare system. For example, the top 5% of healthcare patients, overwhelmingly low income and housing insecure, are estimated to consume 50% of healthcare costs. As such, many in the healthcare sector are increasingly seeing the potential of the home as a platform for health and wellness services and as an essential tool in chronic care management. At Whittier Street Health Center, our model of care for public housing residents exemplifies the ongoing and productive partnerships between HUD and HHS at the nexus of health and housing. In 2010, Whittier partnered with the Boston Housing Authority, the Boston Public Health Commission, the Public Housing Tenant Task Force leaders, and several partners to conduct an intensive 9-month-long community needs assessment and planning process in 5 targeted Boston public housing developments. The assessment identified a high prevalence of chronic disease among residents, unemployment, neighborhood violence, and difficulty accessing a healthcare provider were consistently identified as major issues by the residents. As a result of that 2010 community needs assessment, Whittier established its Building Vibrant Communities and Boston Public Housing program to improve the health and well-being of the 5 identified Roxbury public housing and many more by providing on-site services designed to remove social and environmental barriers impacting healthy living. Whittier's Building Vibrant Communities program was based on the efficacy of public housing residents who we have hired as social health coordinators and our guests today, and are trained to connect Whittier's target population to health and social services. Building Vibrant Communities demonstrate that peer-led efforts by our social health coordinators play a significant role in reducing health and social disparities. Moreover, it validated that improving access yields improvements in community health. Because of our long-standing cross-sector partnerships with multiple organizations who share our mission to promote wellness and address health equity, Whittier was well positioned to respond swiftly and proactively when the pandemic broke to meet the needs of our residents. Our team of dedicated caregivers and staff willingly and selflessly answered the call to serve during a crisis, and in 6 months administered more than 40,000 COVID tests, with 3,521 patients testing positive and linked to care through our mobile units and our on-site programs. In the last 3 months, the Whittier team has provided close to 18,000 COVID-19 vaccinations through our pop-up clinics in the community and on-site clinics. We were thrilled to be one of the nearly 1,400 community health centers across the nation to receive a grant award from the $6 billion allocated to health centers as part of the American Rescue Plan. This historic investment will allow us to further expand access to COVID-19 vaccinations, testing and treatment for vulnerable populations, deliver preventative and primary health care services to people at higher risk for COVID-19, and expand our capacity during the pandemic and well beyond, including improving our physical infrastructure and adding mobile units. We launched our mobile health van program in 2018 to provide medical, behavioral health, dental, vision screenings, and linkage to social services in the community and at public housing development. With the additional support through the American Rescue Plan, we now have 4 mobile units, with the largest mobile unit parked right outside, which was funded by our ARP grants. This new van has been a long-term dream, so we are just so thrilled that this new health unit is equipped with exam rooms, a lab, a bathroom, is handicap accessible, and will allow us to further expand our service capacity so we can do our part to support the Biden administration's vision to create a healthier America. Whittier and all of our health center colleagues in New England stand ready to help with expanded services to meet President Biden's commitment to creating equitable access for vulnerable and minority populations. We are grateful for the opportunity to be of service to our patients and residents, and we thank you for your support. Thank you for supporting us as we continue to address health equity and social justice with compassion, dignity, and respect, and ensure that all patients have access to the highest quality of care, regardless of their ability to pay for services. Thank you. It is now, so today, in addition to being the CEO, I'm the mistress of ceremony. So it is now my pleasure to introduce to all of you our first speaker, Robert HUD, New England Deputy Regional Administrator for HUD. Mr. Forty has worked for HUD for over 19 years in several positions, including as a civil rights investigator focused on fair housing policies and practices. He worked as a branch chief and most recently as the regional support manager. He became deputy regional administrator in the midst of the pandemic last year, and we are so grateful to have him here as one of the speakers. Please join me in welcoming Mr. Whittier to the podium.
Good morning. Good morning. Thank you for those kind words, Frederica, and thank you for hosting us on this beautiful facility. We're here today to talk about a joint agency effort to increase access to COVID-19 prevention and treatment services, including testing and vaccinations among disproportionately affected communities, including among HUD-assisted households and people experiencing homelessness. This effort is part of a national partnership between HUD and HHS that was announced on May 5th by HUD Secretary Fudge and HHS Secretary Becerra. More than 100 million Americans are now fully vaccinated. Our New England states are leading the way in this effort. To raise our vaccination numbers even higher, we must continue to center our efforts around the guiding principle of equity. Many of the people that HUD serves are among the most vulnerable in our society. They're seniors, they're people with disabilities, they're people of color from households of modest means, and they're people who are experiencing homelessness. With this initiative, we will focus our efforts connecting HUD-assisted households with any needed support to register and schedule appointments to get tested and vaccinated for COVID-19, provide culturally sensitive outreach by trusted providers that encourages folks to get the vaccine, and where needed, setting up vaccine clinics at HUD-supported properties and shelters to help bring the vaccine right to people's doors. The undeniable truth is that COVID-19 vaccines are safe, and they save lives. This new partnership between HUD and HHS will ensure that HUD clients have equitable access to the vaccine. This initiative is about saving lives by expanding access to comprehensive COVID care for those in need. It's about meeting people where they are and about bringing healthcare home. Every dose we provide serves as an important step in our collective journey through this national crisis. And today marks yet another step toward reaching that end of that journey. I would like to express our thanks to Whittier Street Clinic President and CEO, Frederica Williams, and her team for hosting us. We appreciate our healthcare providers who have been on the front lines in fighting this pandemic and helping communities get back to normal through vaccine efforts. I also want to thank our Health and Human Services partners, Paul Jacobson and Jeffrey Baird. HUD has a proud partnership of working with our federal colleagues around such issues as ending homelessness, and now we are proud to work together on this new effort. I would also like to recognize and thank Boston Housing Authority Administrator Kate Bennett. We are proud of the extraordinary efforts that have been made by our HUD housing partners over the past year to keep their residents safe from COVID-19, while also ensuring that residents have the critical resources needed to get through this difficult time. At the heart of this effort are our HUD-assisted facilities. I would like to recognize Matilda Drayton, Ms. Drayton is the Lieutenant President of the Alice Hayward Taylor Apartments. Thank you, Matilda, for joining us and for your work to help raise awareness of and encourage your fellow community members on getting vaccinated. We encourage everyone aged 12 and older who has not already been vaccinated to please do so today. It's easy, safe, and free of charge. Thank you.
Thank you for those kind words. We remain committed to your mission. It is now my pleasure to introduce the next speaker, Mr. Paul Jacobson, who is the Acting Regional Director for the Department of Health and Human Services. Mr. Jacobson joined HHS in February 2003 as the executive officer for the Office of the Secretary, Region 1. As the principal advisor to the Secretary's regional director, he serves as the point of contact for all local, county, state, federal, and tribal governments and officials. Mr. Jacobson has extensive background in public health, including working at the Department of Public Health for 10 years. We're thrilled to have you here as our guest and for all you've done at HHS. Thank you.
Well, thank you very much, Frederica, for those kind words. And I wanted to also thank all the staff of the Whittier Health Center for not just what you're doing now, but what you've been doing for over these years. Seems like many of them actually the public health about 15 years. So I think I'm getting old, but that's okay. I'm happy to join you and our partners from HUD and also Boston Housing Authority. And wanted to just say that all of the work that is being done between Whittier Health Center and all the health centers across the country, and particularly in Region 1, is making a difference, and it's giving us an opportunity to really fight this deadly disease. To quote Secretary Becerra, we're getting to where you are, and we're going to invest in you. Zip codes were never meant to tell you what the status of your health would be. And nobody knows that better than all of you. And I should have made my notes a little bigger so I could see them. I'll follow Jeff's lead the next time. Our two departments launching this project is part of our largest mass vaccination campaign in US history, widely regarded as the path out of the worst public health crisis in the century. And it's been pivoting. In the early phase of the effort, which began in December, vaccine supplies were scarce. More recently, doses have become plentiful, but the pace of people getting shots has been slowing. President Biden said that the country should aspire to have 75% of adults vaccinated by July 4th, at least with their first shot. But he and members of his administration have acknowledged that the work from here will be much more difficult, as the vaccination campaign increasingly must focus on reaching people less eager to get one of the free shot vaccines or less able to reach a place dispensing them, which is what makes this initiative so important and really you couldn't do it without your help. This week, the administration began the Month of Action campaign from June 4th to July 4th to mobilize an all of America sprint to get more people vaccinated. You can get information about the activities by visiting vaccines.gov. And we want everyone to be able to go into the summer with peace of mind that they're protected and don't risk spreading the virus to others. Thank you again for all your efforts.
Thank you, Paul. We'll be sure to share that website as our team is out doing community outreach. Now it is my pleasure to introduce to you someone I've known for too many decades, so I'm not going to count them. Jeffrey Beard, who serves as the Regional Administrator for the Department of Health and Human Services, Health Resources and Services Administration, Boston Regional Office. Over the course of his 19-year career, we started at the same time. When I started here, he started at HRSA. Jeffrey has served as project officer and advisor for numerous HRSA programs, including Ryan White's CARE Act, public housing, return and child health, and community health centers. I met Jeffrey when he started his career. He started in October 1993 when he was the first appointed executive director at the Cambridge Men of Color Task Force. And then he went on to DPH to support our men's health program as the director for men's health. And since then, we've launched and expanded our men's health program, and more than half of our patients are men due to the support. So it is my pleasure to introduce to you my friend, Jeffrey Beard, that I've known.
I'm getting old too. Good morning, everyone. Good morning. I'm gonna do that again. I haven't been on 14 months. Good morning, everyone. Good morning. Great. Like Frederica said, my name is Jeffrey Beard, and I have the distinct privilege to serve as the regional administrator for HRSA in Region 1. I want to thank my friend Frederica Williams and her great team here for the chance to be here today to celebrate this historic partnership between HUD and HHS to provide residents of public housing here in Boston and across this nation with access to the COVID-19 vaccine. I'm going to take a minute to thank the entire Whittier Street team on behalf of HRSA for your unwavering commitment to ensure each and every day that the people of this community receive quality care, access to quality care. Ultimately, I want to thank you for saving lives. HRSA supported health centers like Whittier Street are community-based organizations that deliver affordable, accessible, quality, and cost-effective primary care. Community health centers serve nearly 30 million patients each year across this country through 1,400 grantees and over 9,000 sites. I'm going to put it out there. Throughout the COVID-19 public health emergency, community health centers, leaders and staff have been a constant presence on the front lines, providing much needed care and comfort to their patients. Community health centers like Whittier Street have led HRSA's vaccine equity efforts by having a laser-like focus on providing COVID-19 vaccines to underserved communities and those who have been disproportionately affected by COVID-19. Recently, HHS Secretary Becerra announced that community health centers have administered over 10 million vaccines across this country, with 61% provided to racial and ethnic minorities. Please join me in congratulating community health centers. I want to thank them for that life-saving work. Now, I have been inspired time and time again by the vaccine efforts of Whittier Street Health Center. I have been inspired by this team's passionate and relentless outreach, going deep into communities, meeting people where they are, providing life-saving information in a kind and respectful manner, building relationships, and ultimately delivering that COVID-19 vaccine. Now, whether it's a mobile vaccination event at a public housing development, and we know you put lots of miles on local vans here, we know that, and that's good. Partnering with local churches or forming new partnerships to go across town to Brighton to vaccinate Brazilian essential workers. Frederica Williams and the Whittier Street team keep going, keep serving, keep pushing forward. And for that, we are forever grateful. Thank you for your leadership, Frederick. Your steadfast leadership. HHS looks forward to continuing our work with HUD. Thank you, Rob, for your friendship and your collaboration with the Boston Housing Authority, and with trusted community messages like this Whittier program. To make COVID-19 vaccine accessible to public housing residents here in Boston and across this great nation. Thank you so much. Thank you.
Thank you, Jeff. It is a privilege to serve. And thank you on behalf of our wonderful team. It is now my pleasure to introduce another dear friend of Whittier Street Health Center, Kate Bennett, the administrator of the Boston Housing Authority. Kate Bennett oversees public housing and housing choice voucher programs that provide affordable housing for 50,000 people, both in and around the city of Boston. Whittier Street Health Center has worked closely with Kate in several programs to improve the health of the residents of Roxbury, including the Choice Neighborhoods Revitalization at the Whittier Street Health Center, at the Whittier Street Public Housing Development, our namesake, in Roxbury. It is my privilege to introduce to you Kate Bennett.
Good morning. First of all, it's just so exciting to be here in person. I haven't been at an event in person in a long time. It's about the most exciting thing that's happened to me in about a year now. So, thank you all. And I just really want to briefly express my gratitude for the partnership that we're celebrating today. The pandemic has really presented massive challenges to housing authorities across the nation, certainly here in Boston. And the challenge to keep our residents and staff and communities safe is really been something that none of us have ever anticipated having to do. And we have had to put up incredible infrastructure around food, around testing, and now around vaccines. And we've had to be very nimble in order to do that, which is not always what housing authorities are great at. And but our residents and staff have really risen to face that challenge head on. And to their credit, we've really done well in terms of mitigating the impacts of COVID across our communities. But we've really been solidly reliant on partnerships to do that and to be successful. First and foremost, our resident partnerships have been critical. Ms. Drayton, it has been a privilege to work with you and all of the Alice Taylor residents over the many years. You hold our feet to the fire. You engage incredible number of partners surrounding the site. We work tirelessly to improve quality of life at the development, and I just thank you for all of that. Whittier Street Health Center has been an anchor partner for us in this neighborhood for decades. They have always prioritized public housing residents. They've always innovated to address health disparities amongst our residents. As the administrator said, they've met us where we're at. They've come to the sites. They've made healthcare, quality healthcare, incredibly accessible to our residents. And I want to thank Federica and her team for all of that commitment and work, and for this newest partnership to bring critical vaccinations and other COVID-related services deeper into the development. HUD has always been a cornerstone of so much of our work, and I truly thank you and your team for today's investment, but also just for all of the significant investments that HUD has made in our city. At some point today, look out the window across the way at our Whittier development, which is being renovated with HUD Choice Neighborhoods funds. You can see the old, you can see the new. It's really amazing transformation. HUD has invested not only in bricks and mortar, but in people in this neighborhood as this partnership amplifies, and we're truly grateful for that. It's great to meet the administrators from HRSA and HHS. I appreciate you taking the time to come today and for your collaboration at the federal level. I mean, that can only benefit our communities here in Boston. So we really appreciate that effort. We're looking forward to continuing this work toward reopening and ensuring that our recovery is equitable. And as our mayor likes to say, we're not just going forward, but we're going better. And you are all part of that. And so we just deeply grateful. Thank you.
Thank you.
Thank you, Kate. And last but definitely not least is Matilda Drayton. Matilda and I have a special bond. My mother's name is Matilda, and people wonder why I probably use my middle initial. My middle initial is Matilda. So in a lot of ways, I see a lot of spirit, and we are kindred spirits. She is the tenant president of Alice Haywood Taylor Apartments, one of our critical partners in our efforts to address health equity and the social determinants of health. Miss Matilda is a champion and advocate for the residents of Alice Haywood Taylor Apartments in the midst of the pandemic, as we are connecting people to our food pantry, connecting them to the fitness center, to our community garden. She reached out and she wanted a youth program at the health center because she was concerned about the mental health and substance abuse and youth just lingering around with nothing to look forward to. And so Miss Matilda calls and we answer. And before you know it, Christine Padurello and our youth development team out in Alice Taylor Haywood. And she has my cell phone and I called her, I said, are we doing it the way you want it? And she's happy. So under her leadership, Alice Taylor has been redeveloped, made safer, and now has more partners. She's one of the people, whether I talk to Northeastern, an elected official or anyone, I just have to say Matilda of Alice Taylor Haywood Apartments, and they know who I'm referring to. So it is a pleasure to welcome you to the podium. Thank you.
Good afternoon. Good afternoon. I want to thank you all. I don't have notes, but I want to speak from the heart. I've been a public housing resident for 20 plus years and living in Alice Taylor. You have a tendency to feel like you at the bottom of the totem pole, but throughout the years we have grown and we are here now. Because we have leaders in our neighborhood, we have people like Janet, Ms. Frederica will help us, and I want to say thank you to Frederica for your years and years of support. You and your team have shown out there that we are not just a public housing development, we are people that live in public housing. And have an administrator like Ms. Janet who will answer the phone or text when I call or email her within a matter of minutes is amazing. Because never before in the VHA that we have that connection with the housing authority. And for Kate, I want to say thank you for all that you do for us in public housing. We really do appreciate it. And one of the things that mean the most to me by being a public housing resident is how Whittier Street Health Center and that team reaches out to the residents for whatever they need. All needs is being fulfilled with respect, courtesy, and that's one of the things that public housing haven't gotten in the past. And to be the first public housing development to have a COVID vaccination testing site, and also have a COVID vaccination testing facility at Alice Chamber, and after that have COVID vaccination was amazing. Because in public housing, we don't get that kind of service. But with the Ministry of Regional Health, we have gotten that service. And to have the oldest resident in Alice Chamber to be the first resident to come out and get vaccinated was amazing. She was impressed. All the residents out there were impressed because she refused to come out. And to have the team from Whittier Street go to a resident that was autistic, that refused to come out of her home, and to go to the home and vaccinate this 13-year-old child was really, really amazing. And to that, I was to get that one-on-one care is amazing. And I'm going to say, I don't have much to say after this. Job well done. And we appreciate you and your team for all that you have done in the years past and what you're going to do for the future. So that's how I would like to say thank you, everyone.
Thank you, Matilda. It's wonderful to have been the first in Roxbury. I know that Kate and her team were also working at other senior housing across the city, and that's the beauty of partnerships. So we're grateful to have the opportunity to partner with our Roxbury residents. This has been a wonderful press conference. The best speakers for a great cause. But as was mentioned, President Biden has a goal to get to 75% by July 1st. So as much as we are celebrating the accomplishments today, there's so much more to do. As much as the vaccination rates are high in New England, there's so much more to do in the hard housing, for the homeless population, for the people we work for. So we're not patting ourselves on the back. If anything, this is a call to action to step up. So Kate, Matilda, any one of you, feel free to call on us. I may just show up driving that van myself because I've been dying to get in it. I waited 20 years for it. So every time I get by it, someone would say, do you want the key? And I step in, I think, oh, it's too late. But don't be surprised if I show up on a Sunday morning. So this has been a wonderful pleasure, a call to action. And I'd like to recognize our community health workers. These are some of the many people, the phases, people hear my name. We couldn't do the work if it wasn't for the team. Having been the CEO for 19 and a half years, I've seen many changes. And I will tell you that we were blessed to have the best team during the pandemic. Many organizations closed, but every single day, even during the shutdown, we were here, eating too many cakes sometimes, but doing things. And as Kate said, it is wonderful to be out, but we couldn't have done it without this team. So as we call them, and I know I don't even have to ask them, they are already thinking creatively of places to go already, and immigrant organizations and people that do not speak English, people that are worried about having to show their ID to get a vaccination before that has been removed, teaching us about vaccine access and how to address vaccine hesitancy. It's a team effort. We're blessed to have the team. I'm deeply grateful to my colleagues for all you do every single day. Thank you. Thank you. This is it. Thank you.